I'm Dr. Swannie Jett, and I've had a passion for public health for over 30 years. Now I'm in a position to effect change, and these are the critical conversations about health and our community with people who can help me make those changes. Good morning, I'm Dr. Swannie Jett. I'm your host today of CEO Live Talks. Today I'm gonna introduce a dear friend of mine, Damon Cobble, and I'm gonna let him talk a little bit about his project. We're gonna talk a little bit about mental health today and the impacts of mental health on our society. Welcome to the set, Damon.
Really appreciate it, Dr. Jett, really appreciate it.
So tell me a little bit about yourself.
Well, Damon Cobble, licensed marriage and family therapist, also clinical certified trauma specialist with families from the Arizona Institute. Got my undergrad in psychology from Swannie University and my master's in counseling from Campbellsville University.
What percentage of African American men have that much education?
Well, according to research, on a master's level, under 2% of Black male licensed therapists represent Black males in the psychology workforce in the U.S. And so very unique fraternity to be a part of, and understanding that representation matters. So I understand the value what my face means. I understand what your face means in terms of engaging the community.
So you're a unicorn.
No, I don't know about that, but I do what I have to do though in order to help the community.
Well, when I looked at the numbers, there's only like 88,000 of African American men that have a doctorate degree.
Right,
so that was like 0.0002.
Yeah.
So when you talk about going into mental health or a clinical licensed therapist, those numbers have to even be smaller than 2%.
Correct.
So your contributions to the community is great. Talk a little bit about your project that you have.
The Minority Mental Health Project started in 2019, but my journey began 25 years ago in terms of my own mental health journeys and my own struggles.
Yeah.
And so upon me going through the life processes, I realized that therapy was something I needed in order to go down the right road. And so I had a choice. I can either make a left turn or make a right turn. I decided to get the help that I needed, not only for myself, but also for my family. And upon me going through getting my education, I started to identify the gaps in the research when it comes to the barriers of African Americans or Blacks receiving therapeutic services. Mm-hmm. And those barriers were accessibility, affordability, and cultural responsibility.
You bring up an interesting point. And I want you to expound upon it a little bit. You identified, or you self-identified, there was an issue.
Correct.
With your mental health. A lot of people are not able to do that, nor do they have the fortitude to go seek help.
Yeah.
What did you identify? What triggered you to do something?
The downfall of my family, the downfall of self, the shame I had, the embarrassment I was having throughout my journey. And that's just not the life that I wanted to live. I wanted to live a more productive life. So, it was either, I was also suicidal. So I was, experiencing a lot of suicide ideation. And that's just not the road I wanted to go down. So I decided to get the help that I needed.
Now, tell us a little about your mental health project and how that's going to transform the community.
And the Minority Mental Health Project was founded in 2019 in regards to identify the three barriers that I mentioned to you previously: accessibility, affordability, and you have the cultural responsibility. Mm-hmm. And so what we're doing, we're addressing those gaps in the research with the Louisville community. You're looking at accessibility. We're looking to bring clinicians to the West End, to the Black and brown folk. So we don't have to go to them. You're looking at cultural responsibility. We're looking at culturally appropriate therapy for our community, people who understand our culture, who understands our norms, who understands our rituals, and who also understands the research and understand, the modalities that's beneficial to our community. And then you're looking at the financial piece. We also have a voucher program to where we're, for those who are uninsured or underinsured, we're able to pay for them to receive therapeutic services up to so many sessions.
Now, how much is the voucher worth? And then how many sessions?
Well, the value of the voucher, it all depends on what we negotiate with each partner in terms of stakeholder, a licensed therapist, and we'll pay up to value sessions. But they can also get an extension if they're having struggling signing up for an insurance, Medicaid, or whatever, and they can file for an extension or some extra services, extra sessions.
Yeah, so that's a pretty great program.
Yes.
And I have witnessed, through Googling you and some of the other things you've did, and actually attended one of the mayor's forums.
Yeah.
And do you think the mayor or the mayor candidates really have a grasp of mental health and how they can reshape Louisville? Because Louisville has dealt with a lot of violence recently, and police violence. And, give us some talking points of what the mayor can change in Louisville, the next mayor.
Well, the candidates, and it was a great forum we had. It was a great platform. I believe all of the candidates but one participated in that forum. And it's an opportunity for our organization and also the community to hold them accountable in terms of what is your mental health plan? What are you doing? What is your plan to address these gaps? What is your plan to address the violence? What is your plan to address community violence on top of individual violence? So we not only to put them out there and hold them accountable, but we also want to follow up with them and also support them and help them to address those gaps as they progress throughout their candidacy. And until we address those social issues, we are going to continue to experience that negative feedback loop in terms of gun violence, in terms of survival. And that's what our community is doing. They're trying to survive. Until society really address those social needs, then we're going to continue to experience that negative feedback loop.
What are some of the signs and symptoms that a person needs to recognize, and put it in a context like, say, if I had heart disease, right? Yeah. What do I need to do to make sure that I go see somebody right now?
Yeah, and it's very important for, to understand that the mental health also impacts the physical, right? And so I use the balloon analogy, when I explain this, and just think our immune system, as you know, Dr. Jett, is designed to fight off one stress at a time.
Right.
And so just imagine Black and brown folk, going through Jim Crow era, going through the protest, civil rights movement, and just think of that balloon. For every stressor, you're gonna blow in that balloon. You have socioeconomic, you have a structural, you have a family system, you have you have children, you have your children, you have your job. All of those stressors can overwhelm the immune system, and eventually that balloon is gonna pop, right? And so what does that popping look like? It looks like gun violence. It looks like job loss. It looks like it can also translate into heart, the physical piece, heart disease. Stress, depression can cause high blood pressure, so it does have a physiological impact on us. And that's why it's so important to find a therapist or find that resource or find the support to externalize those problems off your system, to take the pressure off your system.
I find it interesting. You brought up a good point. I noticed years ago, when I used to drive through Louisville from Fern Creek to the West End, and I actually was helping kids play football, and my stress level increased. And I noticed it was because, police were surveilling us at a high level. They were racial profiling. This was from 98 to about 2000, 2002. But let's move to talk about now. The number one cause of death for 15 to 34 is gun violence. Welcome back to The Groove. Today I'm having a great conversation with Mr. Damon Cobble. We're talking about mental health and what we're seeing in Louisville and some of the issues today. Let me ask this question. Because, we're getting into now the times where we want to change gun laws,
Right.
right? And it's a hot topic, but yet we haven't addressed the mental health issues that might be associated with gun violence. And I'm gonna peel this back just a step further. There are statistics that show, if you witness gun violence, right, that you might have PTSD later, or you might become a perpetrator of gun violence. Can you speak to that and what the impacts actually might be in the African American community?
Yeah. And what you're speaking of vicarious and secondary trauma, right? So someone who's there, who experienced that, may not be directly involved, but they're still in that vicinity, in the area, and they witnessed that horrific incident, right? And so it's very important that we not only address the direct trauma, but we also address the secondary and the vicarious trauma. And that can linger for years and years, and that is an impact. That is PTSD, post-traumatic stress syndrome. And so addressing that is just as important, as we spoke to earlier, as addressing the victim in that shooting. So you have someone, mother, who is, caring for her son. She's the nurturer, right? Her son gets killed. She may not have been directly been there involved, but it's going to affect the mother also, right? Because she has an emotional tie to her child, which is understandable, right? But not only, does it impact the mother, that's going to impact that family system. Right. And so you're looking at the mother not only having secondary trauma, but you're looking at that secondary and vicarious trauma impacting that family system. And not only does it impact that family system, you're looking at the community, right? Just think if it's someone of high stature, or a politician, or someone who is actively involved in community, well known, that's gonna be community trauma. And so we tend to just focus on the individual who experienced the trauma, but we have to look at it from a systemic and a broader stance in terms of the family system, in terms of community as well.
Let's move toward a subject nobody really wants to talk about, and that's Black on Black gun violence and the strain that has caused with families and losing a loved one, but also the aspect on what it does for other kids, African American men, in witnessing it becoming a norm, and how do we break that cycle?
Well, that's a very loaded question.
That's a very loaded question.
Very loaded. We can go back to the destruction of social struggles of our people. I think Kentucky is maybe considered the fifth segregated state in the country. And so you're looking at communities that have been ostracized, have been deprived of resources, have been deprived of the basic needs, jobs, healthcare, and it goes back to the negative feedback loop. It's all about survival. Right. So our community is finding their own means of survival, and that's unfortunately leading to more gun violence within our community.
So I always had this supposition that we need to bring crisis teams, not just to deal with the individual that was involved or the family involved, but anybody that witnessed it, right? To break the cycle. Do you believe that sending in a crisis team, right, will actually provide some reward and help heal a community?
I think there's some pros and cons to that.
Okay.
I think you provide a resource to the community, but you also putting their resource directly in harm's way. So you have to look at the liability aspect of it too.
Explain putting it in harm's way.
Well, if you send in a social worker out with a police officer.
Oh no, not a police officer.
Well, okay. Well, I need some clarity because that's what. Yeah. Well, that's the new framework that a lot of communities are going to. Yeah. And sending those resources out with the officer to de-escalate and to minimize the the police shootings.
Yeah. So let's say it's not particular police shooter, but it's just a shooting period that occurs, and you have people that it will work best if it's people from the community, so that it's a safe haven for them.
Mm-hmm.
How would that work? Is that something that, because when you go in with the police, it brings one connotation.
Right.
When it's people from the community that you have a built-in team that can be able to address some of the issues.
Yeah.
Do you think that would be effective?
I think that can be very advantageous because that's someone who has a rapport, who knows the community, who has a great relationship with the community, and maybe even works in that community.
Okay.
And so I'm going to be more apt to trust you who come to de-escalate me than more so someone from outside my community who I don't even know, who I don't trust, who I automatically think that, okay, they're looking to lock me up or put me behind bars, so I'm not going to talk to them. But if I see you, I'm going to be like, man, come on, Dr. Jett, come on, can I talk to you? You know what I'm saying? Can you, you know, so I'm going to be out to listen to you more so than someone outside of our community. So I think there's pros and cons, but I think it's a very, very advantageous in terms of the Black community.
Commonly said that eating makes the heart grow fonder, or maybe it's somebody cooking and feeding you that makes the heart grow fonder. But either way, it provides good context because I actually think eating helps with mental health, right?
Yeah, I agree.
So if you don't eat, you probably starving.
Yeah,
you're isolated in the room.
I know it heals my fiance when she eats, so.
I'm not gonna comment. But I have kids that can eat, so I understand.
Yeah.
When they take that first bite,
They're good.
it's something calming about eating and having dialogue.
Right. Yeah.
So I think if more people sit down, have a conversation, right? Maybe there'd be less tension.
Breaking bread.
Right? Breaking bread.
Yeah.
You know, you reduce the animosity. You know, there's probably some strategy to conflict. Because we ain't talked a lot about conflict resolution. Mm-hmm. We talked about the aftermath of it.
Right.
But maybe food is that commonplace. Food, and maybe if it's after hours, you know.
So food is a resolution.
Food is a resolution. So I'm going to say that maybe in order to solve some of the conflict, I won't say the mental health aspect, but at least the conflict, having food to take us along.
Yeah, I think that's a great idea.
So let's dial back. We started talking about, you know, gun violence and what we noticed in the African community. Mm-hmm. We haven't broached the racism, right? Mm-hmm. And the impact that racism could have on mental health.
Yeah.
Peel that onion back for me. What does that mean to you? Because I think you are very relatable to people.
Yeah, you know, you're speaking of medical racism when it comes to mental health.
Yeah.
And we spoke to this earlier. You're probably 0.4% of doctors, you know, on a PhD. 0.0004%. Tuesday. So you're part of a unique fraternity having your PhD.
Right.
You know, I myself, you know, being under 2% of the master level psychology workforce, is very problematic. Mm-hmm. You know, I think, you know, going back to the history in terms of being excluded from the research, being excluded from the data collection has greatly impacted how we are treated as a community and as a people. Mm-hmm. So you're looking at tools that have been created for primarily white men, middle-aged white men. And so that's a trust issue. So, and you have a lot of clinicians who doesn't understand that and does not explain the modalities that they're using on our families was created for a white family. Mm-hmm. And so to me, that's a sense of medical racism and bias. Mm-hmm. We have an ethical responsibility to explain the tools to our clients and give them the option if they want to be part of that treatment. Mm-hmm. And so I think with being excluded from the research, Also, I think academic institutions could do a better job with recruiting minorities into their counseling programs, into their PhD programs, into their master programs, rather they incentivize it, whatever that looks like. I think they could be more intentional with the recruiting of minorities, specifically males, to help address that gap also.
So I'm gonna take it one step further.
Yes, sir.
If I may. What happens to you personally if you recognize a person exhibiting racist acts? And how does that impact you mentally? Because I think a lot of people, and there's been research on this, don't really understand when a person deals with racism, the impact on the body and the mind. So unpack that for me.
Well, that's a very, very loaded question. But in terms of dealing with racism one-on-one, like if I'm faced with it, I think because I know who I am and whose I am, I'm able to, and I have the fortitude to address it face to face. I think that's the best way to deal with it is just confronting it face to face and head on. But in terms of what it can do to the body, and it goes back to the balloon analogy, we want to continue to suppress those true feelings. And what we really want to tell you, I really want to tell you how I feel.
Right.
You know, I really don't like what you said. I really don't like this policy, you know, but instead we suppress it and we internalize it. And then we get home and we'll be like, man, I wish I said this. I wish I said that. But I think facing it head on is probably the best way to deal with it. But you have to be equipped with knowing how to deal with it in terms of the language, in terms of the posture, in terms of, your attitude as well.
Talk to me a little bit about isolation and the stress on the body, mental health that people probably experience during COVID.
Yeah, and those who suffer from, who's already suffering from a mental illness, isolation is very, very real, you know, and it kind of heightened the sense of isolation, you know, because of COVID. You got to look at schools were forced to be closed down, businesses shut down, people were forced to stay at home. And so the isolation is something we have to take very serious that can lead to anxiety and depression. You know, what we're living now, I believe is going to be our new norm. You know, you're looking at the monkeypox, you know, and looking at COVID, you know, so it's going to be a sense of urgency in order, you know, from our country, you know, to really manage these pandemics. But I think we're living in a new sense of norm. Mask may be the normal wear nowadays.
What can people do if you're locked down or isolated?
Just engage your family, even if it's going out on the balcony or the patio. Just get involved with family, play family games, continue to be socially available, you know, to the ones that you love. Continue to support the ones that you love, and it can be challenging. It can be challenging. Just being creative. I think being creative within the confinements of your own home to really address the isolation and to prevent it.
What are some really trusted things that people should witness or notice that's different?
Well, when you're dealing with isolation and then also any level of depression or anxiety, you're looking for one, isolation. Are they withdrawn from their family? Are they ostracized in their bedroom? Looking at eating habits. Are they overeating? Are they not eating at all? Are they engaged? Are they easily triggered? Are they easily angered? Those are some of the common signs of frustration and maybe, you know, a high level of anxiety. So you're looking at isolation, you're looking at withdrawal, you're looking at eating habits, you're looking at sleeping habits. Are they sleeping? Are they not sleeping? So those are some things that I think the community or people can look at overtly to identify if someone is really needing the help. Because what you have to understand is once those anxieties and those symptomologies start to take over your daily functioning, you know, then that's when you need to really get more intense help.
On a final note, tell me a little bit about where you think Minority Mental Health Project can go in the future in terms of reshaping the conversation about mental health and improving. Because the mayor needs to know this. The next mayor needs to have a plan, needs to consult with you in order how we reshape local.
Well, more specifically, if you want to reshape the Black community when it comes to mental health, whoever the mayor is going to be, I think they need to invite all those organizations who are in the trenches doing this work, who understands the heartbeat of the community, who's treating the community, and instead of bringing someone from outside to come in with some grandiose idea that's going to fix the social and the structure of our community, which we know that's not going to happen. So I think they need to, first of all, be inclusive and invite those to the table who should be there at the table.
Okay. Well, thank you everybody for listening today. This concludes Dr. Swannie Jett's first session CEO Live Talks. Great food, discussing mental health and gun violence. Look forward to seeing you again. Thank you.